A resource person who joined that meeting with the president last night is Dr. Susan Pineda-Mercado, a public health expert. We find out her take on the Luzon-wide quarantine and what was discussed in that high-level consultation at the palace. Dr. Mercado, thank you so much for joining us. Do you think that the president has enough data to decide by Thursday, that's still a week before the end of the extension of the ECQ, to basically decide what to do next?
I think we have enough data, Rico. In fact, we have trend data. So it is there is a good reason to make a decision if a decision needs to be made. And I think people will appreciate knowing ahead of time, because whatever the decision is, preparations are needed. So I think the decision will be based on what happens in the next week or so. And criteria have been set out, or parameters that will be measured. So I think there is data to make a decision.
And when you were in that meeting, personally, Dr. Mercado, what was your recommendation?
Well, I took a long view of this. I think COVID is not going to go away. This is something we'll have to deal with over a period of time. And therefore, it's very important that we put into place the right public health infrastructure to be able to deal with this over a longer period of time until there is a vaccine. And that's where the decision on the vaccine came up for the president. He became very excited about the idea of the Philippines participating in the search for a vaccine, because, you know, if a vaccine is developed somewhere else in the world, we're not likely to be high on the list of priority countries who are going to get this vaccine. So having our own capability to manufacture or being self-sufficient in vaccine production is one of the things we need to do. So I think there is the short-term decision that needs to be made, but there have to be long-term reforms and changes. We need laboratory systems, we need the Philippine Centers for Disease Control, and we need production of PPEs on our own. We've seen from the past few weeks that we cannot rely on imported supplies and materials, or even vaccines or drugs and medicines.
And of course, the president is offering a 10 million peso reward for any Filipino who can find a COVID-19 vaccine. In your view, Dr. Mercado, how soon do you think can Filipino scientists, in partnership with foreign partners, come up with a vaccine?
Well, there seems to be a lot of progress in China and in the United States. So there's really been money that's gone into accelerating the search for a vaccine. If the Philippines partners with China and the United States, then we participate in clinical trials. At the same time, we build our capability for manufacturing. Then we could have it sooner than later. But the point is, Rico, we have to start somewhere. And we shouldn't be putting this aside or saying that it's too difficult for us. No, it's not too difficult for us. We were able to produce our own testing kits. We can get to the point where we will develop our own vaccines and manufacture them here.
But the president said last week, Dr. Mercado, that he will only lift the enhanced community quarantine if there is a vaccine.
Yeah, I heard that too. You know, the president is a very open-minded person, and I saw him last night. He's deeply concerned about what the consequences of a lifting would be if we don't have a vaccine, because that's what people are saying, you need a vaccine. But he listened to everyone last night. He would not stop the meeting until everyone had a chance to speak, and you could see the burden that he had. It's really a tough call for him, but I think it was very clear to him now that we're going to have to do without a vaccine, and people's behavior needs to change. If we want to sustain the gains of this quarantine, which is really, we have been able to flatten the curve, as they say, people will have to wear masks, they'll have to do social distancing, they'll have to wash their hands frequently. So these things will not change when this is lifted. So we have to change the way we live, and it's going to be a new world for us.
A new normal indeed, Dr. Mercado. But sifting through all this current data, in your view, where are we now in the curve, and how many tests should be conducted so we can really find out if we are winning this fight against COVID-19?
Rico, we're winning this fight. You take a look at the numbers of people who are in
Mm.
hospitals, people who have died, very low compared to many other countries. And this quarantine has helped. So we are doing really well. Now, of course, once we lift the quarantine, then there are risks. And this is where preparations are needed for testing. You mentioned how many tests we need. It's difficult to give a number, but all I can say is that for every person who is tested positive, you'll have to swab and test all their contacts. That could be 20 people, that could be 50 people. So the ability of local governments to test and to isolate people will be a very important parameter for seeing if they are ready to modify this enhanced community quarantine.
And briefly, Dr. Mercado, I was talking to the Caloocan mayor yesterday, and he said that out of 1.6 million residents, only 102 people have been tested. I mean, certainly many of the municipalities in Luzon and in Metro Manila are really behind the curve. So swab testing really has to be accelerated.
I agree with you completely. I mean, if you have 100, how can that possibly be mass testing, right? There is a move now to increase the number of laboratories. We are pushing for the private sector to come in and do more testing. Germany did a combination of
Mm.
tests, swabbing plus rapid test kits. There are so many models we can use out there in other countries that can guide us to improve our testing. And we really need to do that within the next 10 days. So I agree with you. It's ridiculous to say it's mass testing if only a few hundred are being tested.
Dr. Susan Pineda-Mercado, a public health expert. Thank you so much for your insights.